Welcome. So, if you're watching this, chances are you've probably been told that your constant throat clearing is, well, just a normal part of getting older, right? Today, in this explainer, we're going to see exactly why that dismissal is just completely false. We're going to uncover the four true culprits hiding right now inside your body, and honestly, I'm going to show you exactly how to stop them.
Let me ask you a really honest question. Are you clearing your throat 10, 20, maybe even 50 times before lunch? You know the drill. You swallow, you cough, you sip some warm water, and it works for maybe, 30 seconds? Before that thick, sticky feeling comes right back? It's an absolutely exhausting daily routine. But here's the secret that literally changes everything. Your throat is actually just the victim here, not the source of the problem. Something else entirely is triggering that reaction. So here is our roadmap for today. We'll kick things off with a mucus misunderstanding, then we'll expose our four hidden causes: silent reflux, postnasal drip, ACE inhibitors, and dehydration. And finally, we will wrap the whole thing up with your daily action plan.
Okay, let's dive straight into section 1, the mucus misunderstanding. To really solve this, we kind of need to completely reframe how we think about mucus. I know it sounds gross, but it's actually your respiratory system's essential first line of defense. It traps dust, bacteria, and those tiny airborne particles before they can ever reach your lungs. Now, mucociliary clearance is essentially your body's natural microscopic conveyor belt. But research actually confirms that this clearance system slows down with age. Why? Because the tiny hair-like structures inside you, called cilia, well, they beat much slower and weaker, which means that normal mucus, which would have naturally cleared in minutes when you were 40, can just pool and linger for hours when you're 65.
Moving right along to section 2, our first hidden cause, silent reflux.
So medically, this is known as laryngopharyngeal reflux, or LPR, and it happens completely silently while you are sound asleep. You see, the small muscular valve at the bottom of your esophagus naturally weakens as we age, setting the stage perfectly for our first major culprit. Now, we all know loud reflux, right? That obvious burning heartburn in your chest after a heavy late-night dinner. But silent reflux is entirely different. There is absolutely zero chest burning. Instead, microscopic droplets of stomach acid travel all the way up and reach your highly sensitive throat and vocal cords at night. Because that tissue is just so sensitive, your body panics and triggers extra protective mucus to coat the area, leaving you with that terrible morning hoarseness and a chronic need to clear your throat. Now, this 50% statistic is absolutely crucial. Up to half of all people with LPR experience exactly zero heartburn. None. No obvious digestive symptoms at all. And because it happens so quietly, it's basically the most consistently missed reason for chronic throat mucus in adults over 55. All right, section 3, hidden cause number 2, postnasal drip. When you hear sinus issues, you probably think of dramatic, throbbing facial pressure. But for a lot of older adults, it's actually a very quiet, low-level sinus inflammation that just slowly and steadily drains extra mucus down the back of your throat while gravity does all its work overnight. There was a fascinating 2024 study that perfectly captures this reality. The average patient age for this chronic postnasal drip was exactly 55, with 74% reporting throat discomfort as their primary symptom. It's distinctly an over 55 issue, causing that heavy, awful morning urge to clear. Oh, and a quick warning here, simply grabbing standard pharmacy antihistamines for this, huge mistake. They'll only temporarily dry out the mucus, making it even stickier, thicker, and honestly, way harder to clear out. So the real trick is knowing the right approach. Instead of drying out your system, the method with the absolute strongest clinical backing is daily nasal rinsing with warm saline. This is supported by level 1A evidence. That's the top tier from the European position paper on rhinosinusitis. It's a highly effective, incredibly safe, and super low-cost way to gently wash away the drip and address that low-level inflammation.
Which brings us to section 4, hidden cause, ACE inhibitors.
Now, this cause genuinely surprises almost every patient I talk to. A highly common class of blood pressure medications called ACE inhibitors. When people think about throat issues, their daily blood pressure pill is basically never on the list of suspects. But the typical timeline brilliantly illustrates exactly why it gets missed. Check this out. You take the medication on day 1. It works great. But over the next few weeks or months, a substance called bradykinin slowly builds up in your body. It isn't until maybe 6 whole months later that the chronic throat irritation and clearing finally pop up. It's a very well-documented pharmacological effect. And get this, adults over 65 have a massive 53% higher likelihood of developing it.
Crazy, right?
Okay, Section 5, Hidden Cause, Dehydration and Environment.
This cause is actually a powerful 1-2 punch working against you. Chronic low-grade dehydration combined with indoor environmental irritants. Together, they keep your mucus response basically stuck in the on position. Consider this analogy. I love this one. Think of mucus literally like honey. Warm honey flows beautifully, right? But cold honey is thick and slow. It's the exact same substance, but its environment totally changes how it behaves. Well, your mucus works the exact same way. As we age, our body's natural thirst mechanism dulls. Older adults are often deeply dehydrated without ever actually feeling thirsty. This turns normally thin, healthy mucus into a sticky, pooling trap right in the back of the throat.
Now, before we jump into the solutions, I want you to consider a really important distinction. While morning throat clearing and sticky mucus are super annoying, they're generally benign. However, there are some real red flags that require a doctor's immediate attention. If you ever see blood-tinged mucus, or you experience any unexplained weight loss, or you have difficulty swallowing or feel a physical lump in your neck, please do not try to self-manage this. Your body is waving a red flag, signaling you need professional medical evaluation right away. But for the vast majority of you out there, this issue is incredibly fixable. Take Margaret's breakthrough, for instance. She was a 68-year-old teacher who suffered for 2 miserable years with constant throat clearing. It was so bad her grandchildren literally started imitating her at the dinner table. But by identifying that her clearing started shortly after an ACE inhibitor prescription and addressing her hidden dehydration, she completely solved a 2-year problem in a matter of just 6 weeks. And that brings us to Section 6, your daily action plan. Look, you do not have to live with this. Let's break down a highly actionable, evidence-based daily routine you can start tonight to get your throat back to normal. Here are your first 4 immediate steps. Step 1, stop eating at least 3 hours before bed. When you're upright, gravity is your absolute best friend against silent reflux. Step 2, elevate the head of your bed by about 2 inches using a firm wedge to keep stomach acid down where it belongs overnight. And step 3, drink a glass of warm water first thing in the morning, before your coffee, before breakfast. This immediately rehydrates you and thins out the mucus that pulled overnight. And step 4, start that daily warm, saline nasal rinse to calm any low-level sinus inflammation. Let's finish up your action plan. First, definitely book a medication review with your doctor. If you take blood pressure meds, ask if it's an ACE inhibitor and if an alternative like an ARB might be better for you. Next up, you must hydrate intentionally. Seriously, do not wait until you're thirsty. A great target to aim for is 30 milliliters of fluid per kilogram of body weight. Also, try to reduce indoor environmental irritants, things like dry air or strong chemical fumes. And finally, avoid putting sugar in your warm teas. Sugar actually pulls moisture directly out of your throat tissue through osmosis, which pretty much defeats the whole purpose of drinking it in the first place. Which brings us to our final thought. Are you going to simply accept the dismissal that it's just aging, or will you use this knowledge to take back control of your health today? You now have a completely research-grounded framework to understand what your body has been trying to tell you. Stop being a passive passenger to these symptoms. Use the insights from this explainer, start your action plan tonight, and become the driver of your health once again.